So, welcome everybody. Thank you for joining us today. We're about talking about a very important conversation, which is healthcare and the childless experience. For millions of women, as we know, who are childless not by choice, navigating the emotional toils of going through infertility or whatever challenges we're going through, and also throwing in healthcare can be absolutely daunting. We know that doctors very often assume that there are two types of women who have children and women who are getting ready to. But we know that that's not reality. Today, we are going to explore unique challenges that we face as childless women. We're going to talk about what compassionate and comprehensive care looks like. We're going to look at bias and grief and cultural expectations and talk about resilience and what needs to change. But before we dive in, I'd like to invite our panelists to introduce themselves. Each of them bring a unique perspective, and I'm very grateful to have them as part of this conversation today. So we are going to start with Celica.
Hello, my name is Celica Bears, and I'm based near the Cincinnati, Ohio area. I am an author, a poet, a musician, a singer, and I love being out in nature. It's one of my favorite mental health hacks is to go out and spend time with the trees and the water. And I'm nervous, but I'm happy to be here.
So glad that you're here. So glad that you're here. Amy?
Hi, Sandy. Hello, everyone. My name's Amy Palmer. I am a digital nomad. I've been fully nomadic for about 3 years now, primarily across the United States, but occasionally internationally. And I am host of the Blueprint Breakers podcast, where we showcase women living a life outside the traditional lifestyle blueprint. And I love all things arts related, any kind of arts. So that's me in a quick nutshell.
Great. Thank you. So glad to have you. So glad to have you. And then rounding it out with Leah.
Hey everyone, so glad to see you and have you here to share all of our combined experiences. I am in my 40s. I live near Waco, Texas. I've been a nurse for over 21 years, animal lover. I have cattle, horses, donkeys, ducks, dogs, cats, and rabbits. A large family, live where I grew up, and I'm also nervous but very excited.
So glad to have you as well. And then I am Sandy Langhart Michelet. I'm the founder of the Childless Life Facebook group and the childlesslife.com. And I am the author of My Family Tree Stops With Me that is actually coming out next month. Excited. And I'm also very proud and honored to be a World Childless Week champion. It's one of the things I am proudest of. So so as we begin, I want to set the tone for today. Very, very casual. We're calling this session Coffee, Care, and Conversations. And the idea is simple. We are not sitting around the world in a webinar. We are just all in the same room. We're in a coffee shop and relaxed and enjoying a cup of coffee with a friend. This is a place for honest dialogue, for heartfelt stories, which you're going to hear, and then just compassionate listening. We're going to talk about healthcare, obviously, but we're going to talk about the human experience because, in the midst of all of the healthcare experiences that we're going through, at the end of the day, we are human beings trying to figure out how to maneuver this life that we did not expect. So, as Stephanie said, we invite you to sit back, grab a cup of coffee, go run, grab it real quick, or tea. And then today we're going to share some light on conversations and challenges of being overlooked very often in the healthcare space. And then, more importantly, what can we do to maybe make some changes to that? So, we're going to start here. We know that there's a lot of unspoken grief within childlessness, being childless not by choice. So, we're going to start with the emotional weight of care. So we're talking about the support that we get and sometimes the support we don't get. So I'm going to open this up to our panelists and ask the question, how do healthcare encounters support or fail to support the mental health needs of childless women? Who can answer that for us?
Something that I've noticed is any gynecological appointment that I'm in, I'm surrounded by photographs of babies and mothers, and it's all very maternal centric. There was the last experience I had, there it was kind of like someone that had signed a yearbook, but so there were plaques, and women signed thank yous to their doctors and wrote um, their baby's birthdays and all of those things. And I'm in there just for a personal health appointment. I'm not in there for a visit related to childbirth, and it was very very triggering. It's even I fight back a little bit of tears right now because it was so triggering to be in a space that felt so unwelcoming just for myself as a woman rather than myself as a mother. And that it makes it difficult to want to seek basic care when you go in and you know that you're going to have such an emotional load just being in that experience.
Mhm. Absolutely.
Mm,
Hmm.
mm.
Amy, what about you?
Yeah, Salika, your experience, um, I definitely resonate with that. And it reminds me, when I was in my mid 40s, I had a miscarriage. And when I went for my appointment shortly after the miscarriage, for some reason they had me marked as a natal appointment, and I had to repeatedly tell them that I was there for a miscarriage, surrounded by the pictures of the babies, and it was so traumatizing to me that I avoided. I didn't go back to a gynecologist for over 5 years. I went like more than 5 years without care because of that experience. So I can relate.
What so that was Amy, Leah. Leah, what about you?
So, same. I had a very similar experience where I was going for a post hysterectomy appointment and they kept saying C-section. And I corrected them and they, said it again. And I unfortunately have found that the fail to support is very common, that they're often free with support and encouragement for motherhood and sleepless nights and pregnancy hormones and those kind of things. I personally have not had any provider talk about the mental health needs of childless women, which there are statistical studies, information about how that affects us as we age, with depression rates and anxiety rates and different things throughout our lifespan. Um, and honestly, a very strong lack of empathy, of willingness to listen. You kind of just get a strange look, and then it's just dismissed like, okay, well, we've got you checked in. Um, or someone's trying to relate to you and say something about how it took them so long, took them 2 years to have a child, it took them 6 months to get pregnant with their second, et cetera, et cetera. So and working in healthcare, honestly, there's no training that I've seen for our population. There's extensive training for different cultural beliefs and respect for beliefs and ethnic and gender and weight and age.
Yeah.
I every year do training for how we can be sensitive and respectful of those patients. I've never once seen anything about child loss or childless. And I work in a large healthcare system, like the largest in Texas, one of the largest in the country. So,
That's absolutely incredible. And I know that toward the end of this, we're going to talk about what are some things that medical professionals can do. And I can't wait as a nurse for 20 something years. I can't wait to hear your thoughts on that. For me, I remember when I finally got on Clomid. I got in a Clomid study, and I was talking with when the nurse, and honestly, I don't know if she was a nurse or it was somebody that was giving me all of the medicine and walking me through the steps of the study. And I went back, I don't know, a couple of weeks later, and she said, "Ooh, 7 of the 10 are pregnant. You're almost there." And naive, I said, "I can't wait." I mean, never knowing. And when I look back on that, when she said that, because you're right, Lee. I mean, it's the training is we are here to prepare you to get pregnant. What happens after that? And it's just, I'm still absolutely shocked by that conversation. But okay, great discussion. And I know we've got the chat going. So those of you who are putting things in the chat, thank you for that. Let's get that chat going. And then Stephanie has asked that if we have questions that that you ask the questions in the Q&A section, which you should see on the bottom, depending on how you have it. Mine's at the bottom, but just ask questions in that, and we can get those questions answered for you as well. But yeah, I love seeing all the chats going on. So then let's get to the next one here. So have you ever felt dismissed or overlooked? And this can be in general, any type of doctor, any type of medical profession.
Absolutely. I had a lot of symptoms related to my cycles, and I had primary care and GYN providers who completely dismissed it, did very basic tests, and that was it because you don't have children, so we can't do anything. We don't have anything to offer you. The only thing to do is get on birth control, and then if you want to try having kids later, get back off and see how it goes then, which is very much not the truth. There are options out there. There was certainly more tests and investigation that could have been done. But I heard that so many times from, I went to 5 different um, gynecologists with my symptoms before anyone really even listened.
Unbelievable. Well, believable because we all know that, but it's just unreal. Amy, what about you?
Yeah, I was in my early 30s when I was finally diagnosed with endometriosis, only because I ended up in the ER with such pain after years of lots of progressing symptoms. And the doctor said to me, I mean, I'm not laughing, but laughing. Doctor said to me, well, really the only way for you to get rid of this is to get pregnant, without knowing anything about my situation and I just found it so completely dismissive. There was no conversation. And I ended up having to have one of my ovaries removed. But there was really no support about what my options were or how it was going to affect my fertility or how it was going to affect me going into menopause early. Like I wasn't warned or told or supported in any of that. I had to figure it all out for myself, which took a long time.
That's absolutely unbelievable. What about the affected the trust in the healthcare system? So Celica or Leah, have you had issues with that where now you're like, I don't even trust anything with regarding this. I don't trust anybody to protect my heart or to listen to me. Like, can you talk through that?
Absolutely. So with going through all of those different providers and remembering very clearly the first time I was asking about, I think I might have some infertility struggles. I haven't gotten pregnant yet. And it's been, this many months. The provider was extremely pregnant. She was going on maternity leave like the next day and told me I was being overly anxious. There's nothing to worry about. Um, just a lot of toxic positivity. And then when I called back later, asking about it again, they said, well, I had to see my primary care. I couldn't see the nurse practitioner. They couldn't do a referral to a specialist. And then the provider didn't have an appointment for this many months. And just so many things I'm sure we've all been through that completely changed my trust in the healthcare system. To this day, I don't have trust in the healthcare system that I work in. I'm well known for questioning doctors and challenging providers about all kinds of items, and I do not work in women's health. It's just like Amy said, I went years without going back to a gynecologist or even doing, for example, breast self exams at home. That's a recommendation just because just being so disheartened with the treatment and the level of just not just insensitivity, but having multiple providers, the basic tests that they did do, they did them at the wrong stage in my cycle to tell any information. Um, how many tests did we probably both Amy and many of us go through that they were just looking for pregnancy related information. They were just looking for ovulation and things related to that. They weren't looking for what's really causing any of this or anything else concerning anything related to our overall health or menstruation, menopause, like anything like that. Just looking through pregnancy goggles.
I like that. I hate that term, but I like that term pregnancy goggles because that perfectly explains very often how we are looked through. Like in the beginning, in the intro, I said that doctors feel like there are two types of women. And that's very much pregnancy goggles. Yeah. Yeah. We need to use that. So I'm looking through all of these, I'm looking through all of these chats. These are good. Celeste, I see you say something about no support after hysterectomy. There is, and I haven't been on it for years and years and years, but I know that when I went through my hysterectomy 15 years ago, there was a website called Hyster Sisters, and they had some stuff on there, but I don't know if that's appropriate for us, but I just wanted to share that and throw that one out. Um, yeah, I'm looking at all of these chats. I did get a question and about what specific training would the panelists like to see for nurses, GPs, hospitals, and specialists. And Janine, I asked back, can we wait till the end? And I'm really interested. I'm sure we've got a lot of very good ideas on what they would like to see, and then we want to also hear what you guys want to see. So I think these are very good insights, and thank you for that. The emotional weight of just trying to get care and seek care is difficult when the system is really set up to not even see us, so that makes it even harder. So now I'd like to turn to what happens when all of that pain leads to us avoiding care altogether. So our second theme is the ripple effects of avoidance. This is going to be focused on how misdiagnosis, delayed screening, and isolation, all of that can really impact us. So first question within this section, have your healthcare experiences, CNBC, shaped the way you think about your health and well-being overall? Salika, can we get you to chime in on this one?
Absolutely. I have been experiencing chronic pain since my early 20s, and have it took a really long time to land with a few diagnostics. It took years and years and years of going to doctors and telling them, I remember this one experience. I had written down all of my symptoms, and it took up more than a full page. It was like a page and a third of the back of the page. And the doctor said, with all of this, you should be 60. You should be at least 60 years old to have any of this be going on with you. And I'm saying, and I'm 25, and you're not hearing me. And so that there was complications with my body going on that were setting me up for this childlessness that I'm experiencing. And these complications have been going on since my 20s, and I was being unheard, unsupported. And the lack of support made it really difficult to want to go and spend money. I remember I had a specialist that was a naturopathic doctor. I thought that I was going to go to see someone who was going to listen at a deeper level. And I spent hundreds of dollars on my first appointment only to be met with the same kind of, well, what you've been doing hasn't been working. So here's what you need to do. And here's all these supplements that you need to take and all of this. And those supplements didn't make a big difference in life other than to my pocketbook. And so it was, again, a repeating cycle of deciding that I have hope, deciding that I'm going to try again, deciding that yes, this is there's been research that's happened now. Maybe there's going to be someone who's going to help me, who studied this research. And what I found was I had to take such control over my input. I had to do the research myself. I had to find community support rather than healthcare support. Yeah.
One of the things with healthcare, I know with every, I've heard people say I've got heart disease and my doctors don't listen to us, and I've had something's going on with my stomach and my doctors don't listen to us. And I agree with every bit of that. I absolutely agree with that. Um, it is such a different thing, though, because we've got time against us when you're going through fertility, or when you're going through all of these things. And um, Celica, it's amazing to me that you said that your doctor said you should be 65, but you're 25. To me, that seems like that would be a major red flag, something super wrong. We've got to figure out what's going on. And it's not. It's just not. That's just not what happened. It's just absolutely incredible to me.
Instead, it's as
Um,
if you're making up those symptoms in order
yep.
to receive some sort of special treatment or or medical support that you're not due. It's as though you're creating those symptoms rather than experiencing those symptoms. Yeah.
It's interesting too. I'm reading all of these chats, and Kathy, you're talking about, to the point where you feel like you do not exist. And we all know that as childless women, we very often feel like we're alone and that we're not seen. So then to go to a place where you would think that they would be able to listen to us. No, very often not. Um, I want to stay on this topic of the ripple of avoidance and talk about this, but you said something, Celica, about kind of having to focus on like friends and community and that kind of thing. Can you talk about, and this is Amy, Celica, or Leah, whoever wants to answer this, um, about managing your health and the impact that having a good support system or a not good support system has on you.
So for years and years, probably over a decade, I internalized all this. I did not know a single person who had had this experience of being childless, not by choice, and especially not having answers for so long as to the why. So holidays, I was at home on the couch watching TV in pajamas. I come from a very large, very close family, so I skipped a lot of baby showers and birthday parties, um and then as the years go by, then it's your friends kids weddings, your friends kids baby showers, things like that, and just internalized it because I didn't know a single person, and it's extremely isolating. It's extremely um shaming and you get ostracized and you kind of feel like you just melt into the background, like you're part of the furniture at so many social functions when the discussion is kids or grandkids or pregnancy or wherever you're at in life, and you're not part of that conversation and people don't understand. um, it's just so extremely isolating until I found groups like this where there was anybody that I could talk to that had experienced any of this. And that is incredibly sad, incredibly heartbreaking, and the impact on our mental health that this has had for so long when there are all kinds of mental health resources remote online that I would think that at least OBGYN docs would have a list of resources for people like us.
Mm-hmm.
So then once finding this online community made such a huge drastic difference where I learned it's okay to feel the feelings. It's okay to be angry. We have a right to be angry. It's okay to cope how you need to cope at the process that you're in. And then also to speak up and reach out to others.
Yeah. Yeah, thank you. Thank you, thank you. What about others?
Yeah,
And then let's see that in the chat as well, like about finding community and whether or not having friends and family that you're close to will kind of encourage you to continue to take care of your health or not. But go ahead.
Yeah, I feel like it's in recent years, it's taken me till my mid 50s to feel like I have a good handle on managing my health. And I do think that community has been a strong contributor to that. And not only, like Leah said, it's finding communities online and really connecting with the Childless Not by Choice community has been very helpful, but also talking about it more with my loved ones and friends. So I talk about it much more openly, and I feel like in many ways I'm educating them and bringing new perspectives to topics. Like even when I get together with my girlfriends and we're talking about menopause, I'm also bringing the unique view of what happens in menopause, to those of us in this community, things that they had never even really thought about. So, and I find that by doing that, I have gotten more and more support over the years. The toughest parts were that last 10 years of my quote fertility years, my 30s into my early 40s was the toughest part. And I think community made a big difference.
Yeah. Yeah. Selika, thank you for that. Selika, what about you?
Oh, well, I am also a talker in terms of I bring the hard conversation up rather than not. If it's not, I'll leave the space because my face just tells you everything. And so I don't have the ability to disappear. I have the ability to look really, really awkward or say something or leave. And so I've I really at this point only surround myself with people who can handle difficult conversations. It doesn't, unfortunately, you have to have a certain capacity to be able to handle those conversations in order to be considered a friend.
Mm-hmm.
The challenges with my family, like I have one sister, and we've had some really big struggles because she's a mother of four, and she's 12 years younger than me, and so she experiences a very different life than I experience. And the the last time that I became pregnant was also the same exact date that her most recent child was born. And so I was writing her child's birthday on all of my paperwork, and it just was one of those very odd
Yeah.
coincidences. And then after my child passed away, I had I've had a really hard time connecting with that specific nephew because of that link. And so it affects the relationships with my siblings as well as with my nieces and nephews. There are times when I feel really close and I can really embody that auntie role and really try it and really show up for them as best I can. And then there are times when I don't have that capacity, and it definitely helped. I feel some guilt over not being able to show up for them in the ways that they might want me to. And there's open conversation. I'm really blessed to be able to have open conversation with my family members. They know what I'm going through. They can't really empathize, but they know what I'm going through and do their best to hold sensitivity around it. So I feel very blessed in that regard. But it still doesn't, it still does affect those relationships in a way that creates a lot of challenge. Yeah. I'm also really grateful for the communities that exist online. It's the only place where I have found,
Hmm.
found us.
Because well, Jody, and I see Jody's name all up and down in here, and shout out to that woman who I think has I can't even talk about it without just bursting into tears. And I've told her that she's lucky she doesn't live in the United States because I'd show up at her door every day and knock on her door and say, "Can I hug you?" Because she's just freaking amazing. Um, this, we're talking about the power of having alliances, and I agree. I mean, obviously, I've got a group, so I mean, I definitely agree with the power of that. Um, I have kind of an in-person story. So several years ago, I hit 50, had to do the fabulous colonoscopy that we're expected to do, and I had been years, the cycle of grief. I mean, I felt like I had been kind of in a good place with my grief and that I had accepted it. Um, but when I started the process of going through the colonoscopy, you have to walk in there and then you disrobe. And I had a full-blown panic attack. It was the first time that I had gone because I've not gone back to any female doctor since my surgery. Like everything is gone, so I'm not going back. But but I did have a full-blown panic attack at at the doctor's office and in their clinic or whatever it's called. And they had to go out in the waiting room and get my husband. And I couldn't even talk. I was so upset. And he's like, "What is going on?" And I'm like, it reminds me too much of every infertility treatment that it reminds me too much. Get my stuff, we're leaving. And we stopped for a while and the nurse came back in and she sat and she's like, "What's going on?" And I told her what was going on and she's like, "You can sit in this room as long as you need. I recommend that you do the procedure. I understand it. I'm so sorry this is difficult, but we're here." Um, and I waited probably 45 minutes and then I'm like, okay, I already did the prep, which is, I don't want to go through this again. But it was so interesting that I felt like I was in such a good place, but going through that process and that brought back so many memories, and I had absolutely no idea. I really was very surprised by that. And my husband is part of this. We've talked about managing my health because I have people in my family who have died of colon cancer, and I'm like, I'm never doing that again. And my husband's like, "Well, we're going to talk about it maybe when it's closer time to do it again, but you're strong and you can do this, that kind of thing." Um, so just unbelievable, unbelievable. Um, so let's get into advocacy. And I also one of the things that we have here is that we want to be able to kind of expose, if that's the right word, to each other what's happened in our lives, um, to continue this discussion along healthcare, but then also to give opportunities for us to share information as we're doing back and forth. And there's also some things that we've been through that we choose to remain private, that we don't choose to share. So I'm going to say that I just sent a direct message to someone in our panelist of a piece of a story that I know about, and asking if you'd like to share that because I know that story. If you do not, I'm not even going to call your name. You don't have to share it, but if you do, just message me back and let me know, because I think that kind of what we were discussing, that kind of it would kind of go somewhere around here. But so we've talked about just kind of the awareness overall of what happens in healthcare and how we feel in the experience. And then now we've really talked through what that avoidance can look like, that it takes a physical and it takes an emotional toll on us. Sometimes many of us have become powerful advocates for ourselves because we have to. And then we've become powerful advocates just as what we're doing right now. All of us are having a voice on this webinar, and the panelists and the people in the chat, to talk about that we are not alone and that there are communities out there and there are millions of women in the world that are like this. I mentioned Jody Day earlier. Where I was going with that was that Jody Day talks about instant trust. That's her phrase, instant trust. When you meet someone who is childless, instant trust, because you know there is a sisterhood there that you a lot of times you don't even have to talk about, you don't even have to say it because you know. And that's absolutely absolutely a powerful thing. So it looks like okay, so I'm going to give a chance. I'm going to go back a little bit and open this up for another story that is going to be shared. So I'm just going to turn that over. Um, turn that over.
I'm not sure exactly which part, and I feel like the story is really long. So could you help me sort of sync it up a little bit?
Well, I know the story, and this story makes me cry. About going into the hospital, and um, and then the experience of giving birth, and kind of that experience, what that was like, and not feeling supported, and um, and feeling powerless.
Sure, sure. The first pregnancy I had, I was in my early 20s, and I was escaping from a an abusive relationship, and I moved across the country and I had not received any health care yet. I had signed up for Medicaid, and I had a Medicaid appointment, but that was actually the day that my child was laid to rest, was on the same day as the Medicaid appointment was supposed to occur. When I was experiencing cramps, I thought it was just gas, and so I did not go to the hospital until I saw blood. And when I went to the hospital, they did not believe I was pregnant. And so I didn't receive any care whatsoever. I was just told to wait in the waiting room until my water broke. And then, oh, they believed I was pregnant. And then they took me back to the back room, and um, they had um, it floods all at once, so it's hard to string it along in a cohesive way. Um, Writing it down was easier, but so they back the experience of labor happened in a short amount of time, and my child was placed in the room near me, but I wasn't allowed to hold my child. And it turns out that they effectively allowed my child to die from not being able to breathe. And they did not support this life or try to save it in any regard because they didn't deem it as viable. And they also didn't allow me to connect with my baby as during the time that he was alive. It wasn't something I was conscious of at the time, or I would have advocated for myself. But it was when you put all the pieces together, oh, this is the timing of it, this is what happened. And then because they didn't deem him to be viable, they were not going to give him a birth certificate, so I couldn't give him a funeral. And so my mother actually had advocated for me, and had the director of the hospital brought into the room with me, and, the big head honcho. And it happened to be a woman who was compassionate and did go ahead and issue a death certificate so that we could put him to rest in the way that we wanted to. But during the experience, I felt as though I still wasn't being believed. And then I felt like I was completely disregarded, and that the moments of motherhood that I could have shared with my child, that skin to skin immediacy, was not provided. And the dismissiveness of viability, rather than having a conversation with me about it, just assigning my child to be dead, was very heart-wrenching. And that was my first experience with pregnancy. Yeah.
Thank you for sharing that. Celica sent me that. Celica sent me that, and it just is. It's so powerful, and I've read it, and now I've heard it, and this is real life. These are things that are happening to women all over the world, because there's such a horrible misunderstanding of women. I mean, just of women in general. Celica, thank you for sharing that. And that's why I wanted to private message you that, because I know that is just an unbelievable, difficult story. And my gosh. So thank you. So for this final section, we're going to talk about advocacy, resilience, and change, and kind of the tools and the skills and strategies that we use as we're going. But I wanted to ask Leah, you can answer this better than anyone. And if we in the chat that has worked in the medical community as a childless person, I'd be interested to hear your insights as well. But Leah, can you kind of just talk through what is that like? What department did you work in? What was that like? Can you just kind of walk us through that experience?
Sure. So when I was trying to conceive and going through infertility treatments, I worked in pediatrics for the first 4 years. And in pediatrics, there's a lot of joy. It's 95% young women of childbearing age who are pregnant and having children as far as coworkers. And then if you've left the L&D department, if you've left NICU and you have a problem, you're admitted to pediatrics. You don't go back to obstetrics. You don't go back to the NICU. So extremely emotionally devastating, from the pediatric cancer patients that I took care of to especially the abused infants, abused children. The area I lived in was in the top 10 in the country for child abuse. And it was heartbreaking. And then parents didn't take me seriously when I told them any of the evidence-based recommended anything. And that was one of the first questions. Well, do you have children? How old are they? And when I said I didn't have any, you could just see them like shut down, turn away, and ask someone else, and dismiss me, even though I had not just gone to nursing school, not just gone through all the training, not just gone through all the certifications. I had 3 certifications in pediatrics. Um, and it was heartbreaking. And I will never forget some of those infants, especially um, who had one little girl. She was about 6 months old. She had shaken baby syndrome, and she latched on to me, and I would hold her as much as I could. And it just broke my heart that her parents didn't want her and I couldn't have one. Um, and I would try to hold her as much as possible. And I would ask other nurses, like, if you're not busy right now, could you hold her and I'll go check my other patients? And they would think it was kind of strange that I would want her to be held as much as possible. Um, and then I was also still I transferred, I left pediatrics and I went back to adult medicine. And then COVID happened. And when COVID happened, we didn't know so much about it, but there was concern that there would be negative effects to pregnant women and breastfeeding women. So all of them were exempt from taking care of COVID patients. So I was going through fertility treatment, but I wasn't pregnant. And so the floor I worked on at the time, there was over 30% of the day shift was exempt because they were pregnant or breastfeeding. So there would be days where I would be the only person who could go in the COVID rooms and was asked and expected to work significant overtime. Um, and we didn't know very much at all. So I felt like there were other reasons to be exempt, but most of my coworkers were exempt related to childbearing. And I just felt like I was being sacrificed because I wasn't a mother. And it wasn't just like there were women who had children who did take care of COVID patients, but there were even coworkers who had 3-year-olds who said they were breastfeeding, so they were not involved in COVID care. And there wasn't any research really done on those vaccines. And I don't want to be controversial, but it really scared me because the hospital mandated that we all had to have the vaccines. And I had no clue like what that would do fertility wise. Like I knew something was wrong because I hadn't been able to conceive. So is that going to make it worse or better, or what will that do? And I was very resentful, and I actually got back on a yearly evaluation from coworkers that were anonymous about my attitude towards exempt nurses. And I can very clearly remember all these pregnant coworkers who were coming to work and sitting around and chatting and talking about their baby shower and their nursery plans because they couldn't do anything because so many of the patients had COVID and they could not be around them. So they were coming to work and getting paid and planning their baby shower, and I was running to go to all these alarms of COVID patients and taking care of very critical patients on a non-critical floor and being completely on my own on that whole department to take care of those patients. Transporting patients. In the beginning, housekeeping did not go in the rooms, lab did not go in the room, doctors did not go in the room, speech therapy did not go in the room. It was just nurses and care techs or nurses' aides. So, and I was on the COVID overflow floor. So we didn't have the same staffing. We didn't have COVID pay. And I was so angry. I was very, very angry and absolutely resentful. And then even aside from that, and still to this day, around holidays, who's going to work which holidays, and who's going to cover all the time. I have people, well, why aren't you working? You don't have kids. Well, why can't you cover for me and come in? My kid's sick, the school called. And it's the older I've gotten, the better it is, because now I'm to the age where I wouldn't have kids at home for some people's standards. So it has gotten a little bit better, but yeah, it's been interesting. And then it also makes me think about, okay, what are patients going through? Like, for example, I have friends who have had a miscarriage at the hospital where they The baby was not alive, but was not they weren't aborting on their own, and they had to go through labor and delivery, and the staff were not communicating to each other, this woman, her baby's not alive. And so people would come in talking about your baby, and her baby's not alive, and she's hearing all these other babies cry, and she's seeing all these other women in the hall with their baby and going to the nursery and doing the pictures and all the things. And at the most, there might be a leaf on the door was the symbol that this is a death and not a new life. And housekeeping and just the nurses, everybody coming into that room is just assuming, and how heartbreaking that was and how betrayed she felt. And I would too. I'm so angry still that they did that to her. The same at, like we talked about, like at OB/GYN appointments, all the pictures. When you're going and you're hearing that your IVF did not work, your IUI did not work, or you go for an ultrasound and there's no heartbeat, the lack of empathy and sensitivity and space for your feelings is tragic and unbelievable. And we've all lived these stories. And in this day and age, that there's still so much shame and ostracism and just lack of passion from the healthcare system that is supposed to partner with us and support us and encourage all of their patients. And to be honest, I find that the childless patient is the least. Oncology patients, patients struggling with weight, even drug addiction patients, a lot of times get more empathy than we do. And that desperately needs to change.
That the chat is going crazy
I
right
haven't
now.
been paying attention to the chat.
No, the chat
I'm
is going
just
crazy, and it's because it's so blatant to us that that it is so wrong. And the story that you shared about the poor woman that was going through this and had to go through that experience, and it was a clinical thing to the medical professionals. And thank goodness that you were there and that you could kind of bridge that gap with her. But my gosh, these so we have 4 minutes and we've got some questions. It is hard to transition from all of that into something that I casually called espresso shots, but the idea here is that we are going to shift gears in our last few minutes. These answers are these questions or questions that they may not know are coming. Um, but hopefully full of impact. And then I want to answer some of the other questions that we've got coming in. So tools to use when the grief is overwhelming. Celica, why don't you take this? What are some tools that you can use when the grief is overwhelming?
I use my voice first and foremost. I allow that feeling of crying to come forward, and I allow the moaning that comes with it to turn into vocal toning. And so I become an embodiment for a song that has no words, because there are no words for this grief. There are none. And so it doesn't have to be a song that's written. It's a song that comes from
Amen.
the soul. And so I let that song out and I sing and I sing and I sing. I also play instruments, and so drumming is extremely effective with dealing with the anger of it. Playing the flutes helps bring peace to my soul. Being with art, if you're an artist, and the creative process is such an outlet that is important. And I know that there've been during this World Childless Week have been panelists just for talking about how to use art to manage this. And so, but for me it's my voice first and foremost.
Thank you. Thank you. Yeah, we've got some of this and we've got talks about, yeah, musicians and all kind of things in here. So what is one step you can take to lessen the feeling of aloneness? Amy, why don't you take that one?
I mean, I think it's reach out. I mean, whether it's through the community, through Gateway Women, through World Childless Week, your online community, Sandy, the Childless Life, and just connecting with other women. There are so many of us that can relate to the stories.
I always enjoy watching when new people come into groups and they are um like they're what? I had no idea that this, what? I mean, it's like a beautiful new world that these are my peeps. I found my peeps. What is the best advice for advocating for yourself? Leah, why don't you take that one as the last one of the espresso shots?
Okay, so I think we've all learned you have to advocate for yourself. You have to educate yourself, and use your voice and be aggressive with it. The Whether it's testing or meds or whatever it is, and be selective. And if that provider is not willing to have these discussions with you and support, or friends or family, educate yourself, educate them if they're willing to listen, and if they're not, then they can take a break from your life, and that can be a permanent break, and that is okay. um, I have fired several GYN doctors before I finally got some answers, and that's okay. And it's okay to say, no, I'm not willing to just, do XYZ because that's your pat answer, and you're not looking at it from my perspective or from the fact that I'm childless. Like, why would someone who's infertile be on birth control to treat cramps? That doesn't make any sense.
Yeah.
So educating yourself and being strong enough to not just walk away, that's where I started, but to come back with why and give those providers, those family, those friends feedback of why it's not okay, why you're going through what you're feeling, and how they can support you. And if that's writing a survey response specific to your experience to your doctor or whatever it may be, but not being silent. Like right now, I'm on our patient experience council at my organization, and I've brought this up. Why do we not have sensitivity training for staff?
Mhm.
Why do we cover everything else literally except for this? And offered to share statistics and find resources to educate staff. Um, be bold and give yourself grace to feel these things and not shut them all down so that you don't bother anyone or you don't appear to be upset or you don't appear to be emotional. It's okay to be emotional in work situations, in your healthcare appointment. It is okay.
Absolutely. Well, I think you may have just answered one of the questions that we had was what specific training would the panelists like to see for nurses, specialists, GPs, and hospitals? I know we've talked about kind of sensitivity training,
Mhm.
that they need to understand that, kind of the overall that there are women who do not become mothers, and you need to know that from the very beginning. Are there any other specific trainings? I know we're trying to wrap this up, but are there any other specific trainings that panelists that you would like to see?
I would speak to the University of Cincinnati. When I experienced my most recent, um, um, well, my child passed away at 20 weeks, and I received nothing but amazing care there. And what I noticed was they had so much communication between each other that nobody came in that room who didn't know what I was going through. Everybody was aware. Every aspect of my experience was held with care. There was a photographer. All of the pieces that we want to experience as a mother. I was supported with the, and I think it came down to the doctors setting an example of positive communication. And by positive, I mean gentle, caring, and supportive communication in the staff, so that everyone showed up with a whole heart.
Mhm. Okay. Thank you. Thank you. These are all so good. These are all so good. And we had another question about, is there an online space for women who have never been pregnant? I feel like I'm in the minority. And what I sent back in this one was, I've never been pregnant either, and
Me neither.
that the groups that I've seen are a combination of every, of all situations, yet but still childless. So the end result was childless. Kind of the path to get there may be a little different. Um, and if I can, I can try to reach out if I think of anything, but I'm thinking that that's everything that I've seen. Yeah, Janine, I agree. So let me. So I think we're gonna. We know that it's been very difficult for childless women in the healthcare and the real world, often painful. I mean, we've had a very good discussion with some extremely painful situations, but we know that there are things that we can do kind of as individuals, as communities, as a system to move toward more inclusive care, which is what we want. Advocating for yourself and your health needs, choosing providers who will listen, fire them if they don't, find another one. Um, Creating or leaning on the support network, join one of the support networks that we've talked about, sharing the story, and encouraging healthcare providers to realize that there's more than two types of women. So as we close today's Coffee, Care, and Conversations, I want to give a shout out to Stephanie Joy Phillips, who is the founder of World Childless Week. She is an absolute beast. She's amazing. Um, Stephanie's vision is just unbelievable, and she has brought all of us together all of these years, and we're grateful for her leadership in creating this global platform that's just unbelievable. So I want to thank our panelists, Celica, Amy, and Leah. You were honest. Your stories were strong. They were powerful. They were heartbreaking, and they were real and authentic. And that's, I think, what us coming into this really wanted to hear those types of stories to let us know that it's okay to talk about, and that we are not alone. So thank you for that. I know that takes a lot of strength. So I appreciate it. This conversation does not end here. We have 3 more days of webinars and activities in World Childless Week. I encourage you to join in, participate, connect with others, um, share the reflections, share what you're seeing on social media, use the hashtag. Every post that we have makes it really and truly more, makes this better. So thank you so much. So thank you for being a part of this conversation. And until next time, I hope you carry forth both care and conversation. So thank you so much. Truly enjoy everyone being here. I appreciate it. Thank you.
Thank you. Bye.